So hello everyone and welcome to today's Landscape Analysis Town Hall. We're so excited that you are able to join us today. As I mentioned, we will be recording today's session so that this content will be made available to anybody that was not able to attend live today. Though we do want it to be more discussion focused, please remain muted while the content is being presented. And then feel free to pop any questions that you have throughout in the chat. Um, if there is anything that you need or as a need arises, please just message us in the chat and we will be monitoring that throughout. Um, and then also, if you want to leave your cameras on or off, it is completely up to you. It is not required to leave it on or off. Your presence is just really welcome and we're thrilled to have you here. So we would just like to take a few minutes just to, in the chat, share your name, how you're affiliated with Reach Out and Read Illinois, your clinic name if applicable, and what you're hoping to gain from today's session. And then while those are rolling in, I would like to take a moment just to introduce our newest team member. You see probably a new face in front of all the books too. Rachel joins us as our new Director of Early Childhood Initiatives, and I'm going to pass it off to her just to do a brief introduction of herself.
Hi, everyone. I've met a few of you, and I'm really looking forward to meeting the rest of you. Thank you so much for being here today. Excited to share this information with you and to hopefully meeting you in person soon.
Perfect. Thank you so much, Rachel. And then I'm going to run through our goals for today as well. So our goals for today are to present our landscape analysis report findings with the network. So that involves those that are in the call, as well as those that might be watching our recording later. We would like to gather the feedback from you regarding our findings and the implications of those findings. And we would also like to gain an understanding of any current funding challenges for our Reach Out and Read Illinois sites. And then possibly, if that time allows, we'd like to work on building a work group dedicated to the effort of these report findings. There is another new face that is joining us today. You may have interacted with her throughout the process. Our landscape analysis consultant, Lakeshia Wright. Lakeshia, if you'd like to just take a moment to introduce yourself.
Hi, everyone. It's so great to be here today. Thank you so much for listening to our data spiel. We love it here. So thank you so much. A bit about me. I am the founder and principal of Guided by Community. We are a data and community engagement organization that does a bunch of data analysis and also community analysis as well. So I'm very excited to be here. I've been reaching, but we've been working on this for a while, and so I'm so excited to kind of get your opinions and your feedback on everything. But thank you so much, and I will throw it back to Olivia or Cindy. I forgot which one.
Yeah, absolutely. I'm going to go ahead and spotlight Cindy and Lakeisha. And as I mentioned, this will be recorded. So like I said, if anything comes up, just feel free to pop in the chat any questions that come up. But we'll go ahead and get started.
Hi, everyone. I'm Cindy. I work for ICAP and Reach Out and Read, and I'm really excited today to explain all of the things that Lakeisha and the whole network have been working on over the past few months. But I just wanted to give a little bit of grounding to where we are currently. So Reach Out and Read in Illinois today, we have 196 total active sites, which is huge. It's like a lot of you around the state. And 115 of those are located in Cook County. The map to the right is from National Reach Out and Read, which kind of indicates the density level of our sites in specific counties. And that's important because when we talk about counties across Illinois and where we plan to expand to, this map this is where 196 sites are. We've grown significantly. We've reached 174,000 children in the last year and given away about 223,000 books. If you've been on this journey with Reach Out and Read over the past 4 years, you will notice that these numbers are much higher than they have been in the past. And that is thanks to all of your hard work and a state investment in this program. So you can go to the next slide. And so the goal of the landscape analysis we have been growing, as you can see. But what we really wanted to do is take a point in time and understand where there are opportunities to grow and where we currently serve our community. And so we wanted to take a moment, look at the data in our state, and understand where there is opportunity to deepen impact into our existing Reach on Read program sites, and then expand into other priority geographies across our state, especially getting outside of Cook County. We also wanted to take a moment to understand how our expansion, how we could drive our expansion or our deepening of our program impact related to state funding priorities too and opportunities, and just really help push early literacy um,
No.
in our state. And so these were all kind of the goals, was to take a moment in time, look at where we are currently, and figure out how we want to direct our future with everyone, with our whole network. And so that was the purpose of our landscape analysis. And so Lakeshia, I'm going to turn it over to Lakeshia to kind of review exactly what we've been working on since January, to better understand, where we are at this moment in time and where we want to go. So I'll turn it over to Lakeshia.
Thank you. So we really went through a process where we looked at what we have, what we could get, and then where we wanted to go, essentially. So we did, excuse me. So we did surveys, site data, and then book distribution numbers. And then we looked at geographic gaps. So that's really mapping where there were underserved zip codes. And underserved really kind of came down to looking at what was technically considered underserved by data standards, and then also what we consider to be underserved as well in terms of education and things like that. And then we did clinic readiness, where we looked at the capacity, infrastructure, and staff engagement. Then we also did qualitative insights. So we did our focus groups with clinicians, and we did I did surveys already, but we did just a lot of qualitative impact analysis and things like that. And then we looked at supplemental data. So we looked at poverty rates, insurance coverage, education levels, and proximity to hospitals and proximity to libraries as well. So I will send it back, or actually, let's see what the next one is. Oh, yeah, I'll give it back to Cindy. Oh, you're on mute.
Sorry, I still don't know Zoom after all these years. So just to take us back, because most of you on this call have been on this journey with us. So in January, we hired Lakeshia. We've asked you guys to fill out a number of surveys. We've done a number of focus groups. Many of you on this call were part of those focus groups. We also presented at our May site support meeting to over 80 people in our network, some preliminary report findings. At that discussion, we got a lot of new ideas for data. And so Lakeshia took those into account and included those into our final product. We shared the full report, which is quite lengthy, with the staff and the recommendations for future direction. And right now is where we get to share it all with you and get your feedback input on our next steps. So Olivia, do you want to go to the next slide? So Lakeshia, do you want to talk through the survey findings? I know there's 2 slides for this.
Yeah, so jumping into the survey findings, which by the way, thank you guys so very much for participating in this. Your feedback and just your support throughout this process has been incredible. And I just want to take a second to personally thank you so much for all of the work that you did to help me do my work. I couldn't have done it without you, so thank you. But jumping into what we found through those surveys, we saw that there was a barrier to care. So many of the clinics said that their families face challenges in getting services like financial barriers or lack of transportation. And then some clinics weren't sure because they weren't necessarily measuring that type of data. It was really kind of anecdotal, but they know that they were seeing that there may be more need through their families. Then there were well child visits. So most clinics say that families were not missing appointments, but some say some children are. So there's a big chance to dive deeper into what's happening there and to be able to support families better. And then also we found out about using services. So a majority of families said they're using services that were offered, but some clinics weren't sure. Again, once again, just a matter of measuring and looking at that data anecdotally. But we figured out that there was a sign that there may be a need to check in more with families and then to track usage more clearly. Next slide. Thank you. So we looked at who's being served. So most clinics are in big cities or nearby suburbs, but we also heard from small towns and rural areas. So families live in all kinds of communities that are coming through and being served. And then getting to the clinic, we found that most families were driving, but some, of course, were using other modes of transportation like walking, taking the bus, using rideshare apps. So that tells us that transportation options are very important. Just a little bit deeper into that, given my background in looking at these things, I just want to throw out there that transportation is always a huge issue with how and when and the quality of appointments as people use services and things like that. So I just want to throw that out there. It's just a little anecdotal bit to why we're looking at transportation in the first place. And then we also had library connections. Nearly all clinics are working with their local libraries, which shows a strong link between early literacy and healthcare, and then growing the program. Over 30 clinics said that they want to expand the Reach Out and Read program. And then others were unsure but open to the idea as well. Next slide. So I'll jump into what the focus groups. Um, Again, thank you. I know some of you were here and met me before through the focus groups, and I'm so happy to see you again. But just going through what we heard from those focus groups that we held, it was extremely positive from all participants. They were seeing a simple and powerful intervention that builds literacy and parent-child bonding and developmental monitoring. And then children's excitement about receiving books is seen as a direct validation of the program's impact, and then parents' reactions were overall positive. So then in the category of understanding program goals, participants widely agreed that Reach Out and Read was intended to promote early childhood literacy, support school readiness, especially with underserved children, foster strong parent-child relationships through shared reading, and then also to serve as a developmental assessment tool. So in other words, like assessing pointing, color recognition, and turning pages. Next slide. Um, I believe I'm doing this one too. Just let me know if I'm just flying through everything. But
Yes.
okay, cool. All right, so key data insights. So the analysis included drive time analysis. This was huge because we realized that the further people travel to get to sites, the less likely they are to have constant visits. They may be making the necessary ones, but there might not be going as far to get to other ones. In general, that's seen across all modes of transportation, that the further you go, the more it drops off. But we show that their long distances reduce access to care. And then for poverty among children who are 0 to 5, they highlighted where literacy interventions were most needed. Then healthcare gaps, we identified were low access to pediatric care. And then library access, which informed their potential partnership and resource alignment. And then race and ethnicity and socioeconomic indicators ensured racial and linguistic equity in targeting new sites. Cool.
Thanks. And so Lakeisha took all of these massive data points and layered them on top of each other onto our Illinois maps. So, measuring the drive time, understanding what programs exist currently, and then we layered our Reach Out and Read current sites on top of that to help drive our decision making and understanding of what our current landscape looks like. So all this was done as we highlighted from January until June. And we acknowledge that the last few months have been a little chaotic. And so we might need to consider some other data needs as we move forward. And so one of the things that we are kind of building into our discussions on our priority areas and on the recommendations is understanding better implications of federal funding cuts that might be coming down the pike, especially as we think about expanding into rural footprints that really do need the program, and what that would look like. Medicaid cuts, understanding rural healthcare, as I mentioned, the impact of ICE on well child visits in general and in Illinois. And then I'd like to also open it up to this group. You could put it in the chat or unmute yourself. But if you have other things that you think we should consider as we continue to move forward. As we all know, like collecting data and understanding the current landscape is always going to be a moving target. We're going to do the best that we can with the data that we have available. And I think it will be an ever evolving strategy that we develop given the external environment changes, and how we need to accommodate for those. So we just wanted to let you know that we are considering other kind of data points to be enveloped into this kind of thinking.
We do have
So
a
if you-
question in the chat. It might make more sense to answer this now.
Okay.
So Sweda says, those 30 clinics that you mentioned that wanted to bring Reach Out and Read to their clinics, what types of clinics were they, and did they need assistance on funding?
Did you want to unmute yourself and like expand that at all? You don't have to. I can like respond to it. But yeah, I think they were like, I think you're referring to, okay, no worries. I think you're referring to some of the like data that we collected before. And I don't think it was any specific, like they were all FQHCs or they were all like part of one healthcare system. So they were kind of a mixed bag, but we can go back and like drive deeper into it. I think that the clinics that mentioned they wanted to bring Reach Out and Read, expand the Reach Out and Read program or had capacity to build more, had a variety of different structures as well as ideas about funding. So a lot of them, as many of you on this call, want the program and are having trouble finding the funding for the program or having trouble to get existing funding to like be greater. And so those are things we're all kind of considering. Should we move to the next slide?
I would just like to add that we actually, in that survey, asked specifically about expansion. We didn't really get any survey results from anybody who is not already a part of the Reach Out and Read network. So that's something that is just.
Thank you, Olivia. That's a very good point. We surveyed like our existing network. So what we wanted to know is if you're part of a big hospital system, are there other pediatric clinics within your system that have the possibility of, adding on a Reach Out and Read program? So it's those kinds of things. But I think we can move right on to the recommendations because I think we'll have a lot of questions on those. So Lakeshia gave us a very, 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 very large report with like the best graphics ever. And we drilled that down into something that we can present to you in a reasonable format. So there might be some gaps here, but we came up with 5 recommendations for moving forward. And we're going to kind of go through those. But the first one is really advancing, like figuring out what expansion looks like outside of our current Reach Out and Read footprint. And then the second one is deepening our investment in our current Reach Out and Read network. So those two kind of go hand in hand. And we've talked at length about them over the course of this project, where how can we continue to expand the program while still maintaining the vibrancy of our network in the 196 sites that we currently have. So we know not all of you are fully funded, and we know that we have a long way to go. So these two kind of work together, and we'll go into them deeper. And the next 3 strategies and recommendations are really about building strategic partnerships and thinking about funding and program sustainability enhancing our statewide data systems and evaluation capacity in working with the National Reach Out and Read data collection system, and positioning Reach Out and Read Illinois as a statewide leader in relational health. So some advocacy and policy recommendations. So we'll move to the first one. So this is a lot of words. And we will be sharing the slides later, but I just wanted to highlight that we looked at every single county where we currently exist in Illinois and where we don't exist, or where we like have one site. And then we mapped that with Lakeshia's data to identify these top areas where we think there is definite room to expand the Reach Out and Read program. And so the Illinois Valley and LaSalle counties, we currently don't have any Reach Out and Read sites, but there's really high child poverty rates and very long drive times to clinics and libraries. So when you think about that community, having a Reach Out and Read program in their clinic would be such a gift to those families. We also want to look at McLean County, which is Bloomington. That's also where Olivia lives. And so we have one Reach Out and Read site in Bloomington. But there is a tremendous amount of need in that community, and there's already a really strong early childhood network ready to support growth, as a college town too. So that's another priority area. Springfield is another priority area. There's nearly 20% of child poverty there, and there is only one Reach Out and Read program. And it would also be a strategic investment, since we do go to Springfield and talk to our legislators often. Champaign County, like Champaign-Urbana, there is one Reach Out and Read site there, but there's really uneven access to libraries and healthcare, but there's a lot of strong potential local partners like universities and libraries. Brown County has no Reach Out and Read sites, but it's really high poverty and a lot of literacy access challenges. So this would be one that would be a huge lift, but again, a gift to that community. And then in Chicago, south and west sides in the south suburbs, there is a huge need to boost our Reach Out and Read programs in these areas, and really help our strong existing community networks. And the last priority area that I will mention is St. Clair County. So that's East St. Louis. There are some Reach Out and Read programs there, but they are served by a different affiliate. So that would be a discussion with National Reach Out and Read to understand our role there and how we can help support that community in coordination with National or in coordination with partners in St. Louis. So these are the areas that we have another slide with a lot of maps. But these are kind of the targeted regions where if somebody gave us a ton of money and was like, go to a place that has never had Reach Out and Read or has potential to build a Reach Out and Read program, these are the areas that we would look to based on the data. So that's recommendation number one. If you have any questions, please put them in the chat, or like reactions. We'll have time for reactions. Recommendation number two, this is where you all come in. We want to deepen investment in existing sites. So 53% of clinics in our current network are interested in expansion. So we really want to look at that. We will be sending out a survey about funding during this meeting and afterwards to better understand where your struggles are and where we can better engage with some sustainable funding measures to help the Reach Out and Read program gain footing in your clinic, hospital setting, what have you. We really have a lot of ideas around this recommendation, such as piloting a mentorship program where maybe a very high performing clinic can be paired with like a newer clinic to help support each other through clinic flow implementation. But we want to make sure that we are able to deepen investment in existing sites. So that's kind of the summary of this recommendation. And then recommendation 3, I know there's a question about interested in expansion. The 53% number is based on a survey that we provided to our whole network. We surveyed them twice and asked this question, I believe, both times, where we asked, like, are you interested in expansion? Is there room to expand in your clinic? And so 53% of our current network answered yes, to clarify that. And recommendation 3 is building strategic partnerships to drive funding. And so this is where, you know, this is what we do at Reach Out and Read Illinois. We are constantly trying to connect with local leaders, Head Start networks, libraries, clinic champions, hospital system administrators, understanding community-based organizations, attending conferences, networking, leveraging the Illinois chapter of the AAP relationships to better build program sustainability and diverse funding. So that is recommendation 3. 4 is enhanced data systems. So all of you that are part of our Reach Out and Read program know that we ask for your numbers twice a year through MyROR, which is the National Reach Out and Read Data Collection System. This is all self-reported data. We are not proposing to change any of the data collection systems that National provides for Reach Out and Read programming across the country. What we would like to really explore and do is understand the qualitative data. Through this process, we have surveyed you, we have engaged you in focus groups, we have held meetings, and the more we hear from you, the better we learn about what's going on the ground. And so what we want to do is be able to boost capacity to understand this qualitative data, to be able to talk with you about what's happening in your clinic, what challenges you're facing, what successes you're having. And so we want to be able to build some collection tools that will allow us to have a sense of what you're dealing with in your clinic on a daily basis. We'd also like to build a statewide dashboard that kind of visualizes how we're doing on book distribution, how we're doing on like school readiness, and all of those metrics here in our state that we're really looking to invest in to make sure all our kids are kindergarten ready. So that's recommendation 4. And then the next one is our 5th and final recommendation, which is really elevating the Reach Out and Read Illinois program as an investment for public agencies and philanthropic funders. I think that everyone in the healthcare community and everyone on this call knows and loves the Reach Out and Read program, but I would say it's largely a program that's under the radar to the general public. And so what we really want to do is be able to elevate and lift up our visibility as an organization, and build, you know, more partnerships with strategic funders that will help all of you develop a fundraising toolkit for clinics, help with a communication strategy that supports Reach Out and Read as a public health intervention in Illinois. And so the recommendation number 5 is really about like kind of taking our whole network up to be able to show all of us as a great program that should get more state funding and more recognition. So those are our top 5 recommendations that we pulled from all of this. And I've been talking for quite a while. And so now we would love to hear from you. And I know there's some comments in the chat, but I'm going to turn it over to Lakeshia to explain this.
Oh, we would love to get your feedback in real time and have you guys be able to interact with each other in terms of feedback. So what you see on the screen, and I'm going to share my screen in a second, and you'll see this exact same thing, just a lot larger. What you can do is you can go to menti.com and put in the code, the 8-digit number that you see on the screen, or if you have your phone and you're using this on your screen, you can scan the QR code and join in. But
It's
Okay.
also in the chat.
Yes, thank you. That's great. Thank you for putting it in chat as well. So I'm going to share my screen. All right, hopefully we're all good and everyone can see this. So again, I'm gonna give you guys a couple seconds to log in. I see 5 of you are in already. This will be up on the screen. It'll be in the top too, just in case you accidentally logged out. All right, we have 6. I believe that is the magic number that I'm looking for. All right, so well, the way we're going to do this, oh, I see 7. Cool. All right, the way we're going to do this is I'm going to have each recommendation come up on the screen, and what you have on your phone is the ability to make a comment about that recommendation that you saw. So it can either be a question that we can answer in real time, it can be a comment of like, hey, I love this, or I don't understand this, or something like that, not to lead you into what you need to say, but please say whatever you're thinking. And we'll walk through all 5 recommendations through your comments. And then at the end, there'll just be one blanket way for you to give comments on the overall process that we did and for this overall results that we got. So you can start putting those in. And like I said, they'll start popping up on our screen. Feel free to interact with each other. And yeah, this should be great.
Are the comments anonymous?
Yes, I did purposefully set it to be anonymous.
Donuts, everyone.
Yeah, I wanted people to be able to give their direct feedback. Hopefully, they'll start popping up soon. All right, so thank you. Thank you for filling these out and giving some questions. I will love the comments. Thank you. As a couple more pop up, I will let Cindy and Olivia and Rachel answer some. If it's a data question, I will answer. Um, cool.
Yeah, these are great. So yes, it's a lot of counties. And no, the goal is just to identify these target areas and then figure out an implementation plan. So maybe we target the first county, like one county, in 2026 and devote resources to that. So this is just kind of a snapshot of where we think there's opportunity.
I can possibly pull with the help of the team here, those clinics, and yeah, look at who's actually represented in that list. That shouldn't be that hard to
Did in
do.
the chat already.
Oh, cool. Thank you.
Yeah.
Thanks. Yes, and I do think that we are looking at the types of clinics that are present in those targeted regions because every region has a different kind of clinic footprint. And expansion will always be based on funding opportunities. So yes, funding is one of those areas that we have to kind of focus on in order to get a program up and running, but we do have staff to be able, current funded staff to be able to go start conversations with hospital directors or other kind of clinic directors that have access to their budget or are interested in learning more. Did we answer all of these questions?
I think so. If there's
Don't
something
be
that comes up,
embarrassed about Springfield. I just saw that one. We would love to expand in Springfield. So thank you.
yeah, if anything comes up, sorry to interrupt you, Cindy. Yeah, if you something comes up later, there'll be a space for you to kind of reiterate things and stuff like that. But the Springfield one did make me smile too. Okay, I'll move on to the next one. Again, nothing's ever final. It's just paused until we get to the next space. But if anything comes up, please let me know. All right, recommendation 2 is to deepen investment in existing sites.
Yeah, so just to answer questions as they pop up, the sources of, like, when we say deepen investment, that just means if we get funding, we would, invest in our current sites. So I don't necessarily have a sense of where the sources of those investments are. Again, this is just our priority, and then we will operationalize it and like start to spell out who and what and where. But yes, of course, like non-targeted. So this recommendation means that all of our 196 sites that we have currently, we want to make sure that you continue to thrive with the program. So the targeted regions in the slide before is like a different priority. Those are folks that like are new to the Reach Out and Read program. So this is like making sure that you're coming with us. So restoring the mini grant program. So as many of you know, for the past 3 years, we've had a mini grant program that has been offered to both new sites and existing sites. We've had it on pause until we had this landscape analysis defined. And so we are in discussion about what we will do with the mini grant program and where funds will be allocated. But yes, that is definitely one of the areas of how we deliver funds to our programs. But I love that you love it. So that's good.
Any additional things? I'll give it like 10 more seconds just in case someone's still typing. All right, on to recommendation 3. So it's build strategic partnerships to drive funding and program sustainability.
And here we would love your feedback, but also if you have ideas about partners, this is the place to list them.
Yeah, if there's like you run into that issue of your comment not being long enough, please feel free to put in chat if you feel comfortable. If you want it to be anonymous, you can always paraphrase or tell us in the future too, if need be.
So the one comment on here is about food deserts in the chat. And so I think that that's a good thing to look at in terms of community partners. I know some of our clinics do have like food pantries as well. and partnerships with local food pantry organizations. Yes, and United Way is always a great partner. And so I do happen to have all of the United Way contact information for every county. So we have been, as clinics come to me and say they've lost funding or they need funding, I've been connecting them directly with their county United Way. So you can always reach out to us for that. Or I believe we also have the United Way of Rock River Valley on this call as well, that would be able to help point you in the right direction. But we are building like kind of statewide partnerships with United Way too. And I love the idea of departments of commerce. These are great ideas. Thanks all. Did we answer everything here? Lakeisha, I think we could probably move on to the.
There's one more. Is there a way to involve school systems?
There might be. We work a lot with different schools because our program is a pipeline to kindergarten readiness. So we can definitely put that down as a build strategic partnerships.
All right, enhanced data systems and evaluation capacity.
So not only will we love your reaction to like a statewide dashboard, but like metrics or things you would like to have measured or things that would be helpful to you as we think about collecting data or what's maybe annoying for you when we ask you for data or what do you not want us to survey you on. All of those things are welcome in this space.
It's a valid concern.
Yeah. I would like to promise that we will not require more work on your end to give us more data. And that, so this Zoom is recorded. And so I am saying that we will not require you any more data. There are we are collecting data from your clinic all the time. And I know that you have requirements for many other programs other than Reach Out and Read. So we are well aware and we will try and make whatever we implement helpful for you as much as it is for us. Yes, I think that's the goal here with this is like local outcome data to understand like how things are changing in your neighborhood, in your community, in your county. So that's the goal here, and just streamlining data we currently have. So whether that's in a system like Epic, thank you for mentioning that, or however in the My ROR reports you're already submitting. And I like the idea of building in some data points around like locations to schools and things like that. Great.
Cool.
Thanks.
All right. Position ROR as, or sorry, Illinois as statewide leader in relational health. I felt like this one was much longer. It didn't fit. So hopefully, if you need me to flash back to the other, like the longer version of this,
This I
if
can
people
just
don't remember. Yeah, I was like, wait, this one cut off.
this is where we want to elevate the visibility of the Reach Out and Read program in our state. So whether that's through legislation we do, policymakers, like building relationships with policymakers and legislators in our states, building more sustainable funding relationships, all of those things to kind of help bring up our profile and make us as visible as, the Dolly Parton Imagination Library and other programs that are in this same space. So again, like any ideas that you have, or any feedback that you have around us focusing some resources on this recommendation. I love that. I agree with that comment, whoever posted that.
Any other additional ones? Okay, cool. Just making sure it didn't like freeze. All right, we're good.
Yes, our governor is a big supporter of Reach Out and Read. And partnering with other organizations that can also promote Reach Out and Read. It sounds like everyone's like also agreeing that this is a good priority to have. And there's a lot in the comments too. Great.
There's one more, but for the sake of time, do you want me to skip it?
Maybe we could just open it up to the floor. Sure. Yeah, if you have any other feedback or overall thoughts. I'd especially love to like know or hear if you agree with these priority areas. Did we miss anything? Would you like to be involved in next steps with this document? I just would, it sounds like everyone was in agreement with these priority areas, but this is a great time to say, like, I don't think we should be doing anything with data. Like, just take that one out, please. Those kind of comments we would love to hear back. You can also put things in the chat, and we could also just open it up for just, Lakeshia, if you're okay with opening it up just for like Q&A, we could stop sharing the screen and
Yeah.
okay, sorry, before I did that. Great. Great. Well, we should close the screen now if everyone agrees.
I'm good with that.
Yes, and definitely like providing more tools for our sites that are specific to your situation in Illinois, I think is crucial and definitely a top priority as we move forward. Great.
Well, I'll stop sharing my screen. If
Okay.
more things pop up, you're still logged in technically. I will share this with the rest of the team. So yeah, thank you.
Thanks, Lakeshia. I just want to give a huge shout out to Lakeshia for leading us on this journey since January, through all of the twists and turns we threw at her, and the external environment that kept popping up. So I do think I just want to like huge shout out to Lakeshia. She runs an amazing organization that really does this mapping work and data collection and analysis really well. So if anybody needs any support on those projects, I would definitely reach out to Lakeshia and Grounded by Community. But I'd love to just also open it up to this group, and just feel free to let us know if you're interested in continuing to participate, or if you had any other comments or feedback as you're digesting, a lot of data and words and talking at you. I'm supposed to give it like more time than I always do because I hate awkward silence. So, but there is a funding survey link in the chat, and I would love for anybody that has a Reach Out and Read program that's on this call to take the funding survey. This is another data point for us. It's very, very short. We made this like 3 or 4 questions. Like, you should be able to complete it before you log off this call. And we just want to know, like, we're trying to get a pulse of where our current existing sites are and what you're struggling with and how we can best support you. And so if you could take the funding survey, and then Olivia, I know we have a slide about our upcoming events that we can show now. Did you want to talk through these, or do you want me to?
I can do it.
Great.
So we have a few events coming down the pike. First in October, in just a few short weeks, we have our ICAP Annual Education Conference. It'll be taking place at Northern Illinois University in Naperville, Illinois. There will be a pre-conference on October 15th and the full-day conference on October 16th. More details about this can be found on the ICAP website. We are in the early stages of planning our Early Relational Health Summit, which will be taking place in 2026 from March 4th through 5th at the same exact location as the annual education conference. It'll be at Northern Illinois University in Naperville, Illinois. And then another thing from ICAP is our mental health conference. It'll be May 7th, 2026 at the Jump Training Simulation and Education Center in Peoria, Illinois. All of these events are listed on both the Reach Out and Read Illinois website as well as the ICAP website. But we will always be sending these events and anything else that comes up, as well as updates in our newsletter. So please make sure that you are subscribed to our newsletter. We try to only send it quarterly, but if there's more important things that come up in the meantime, we do send a little bit more frequently than that occasionally. But for the most part, it's mostly just quarterly. But that is all the things that are coming down the pike. Thank you so much to everybody for joining us today. If you are interested in joining us for next steps, please shoot us an email. You can contact any of the members of the Reach Out and Read Illinois team, and we'd be happy to connect you with that process. But that is all we've got for you today. So thank you so much for participating. Thank you to Lakeshia and Cindy for leading us through this discussion. And I hope you all enjoy the rest of your day.
Thanks, everyone.